Welcome to Growing Bremerton Together with Mayor Patty Land. I have a special guest today. It's Dr. Scott Lindquist. He is the health officer and the manager of the Kitsap Public Health District. It's located right in Norm-Dix Government Center, and that's the location we're going to be filming from. Stay with us. Welcome to Growing Bremerton Together with Mayor Patty Land. We're on location today at the Norm-Dix Government Center, and I have a special guest. In this building, my City Hall on the 6th floor, and also on the 3rd floor is our Kitsap Public Health District. And Dr. Scott Lindquist is the manager, the boss, the medical officer that takes care of the people that come into that department or that district office. And we're going to learn some things about what's going on in our city, in the county, and really in our state. Welcome, Scott.
Thanks.
Let's first learn a little about you. I know you've got a marvelous education, and you're also a native resident of Kitsap County. So you were born in?
I was actually born in Northgate Hospital, which is no longer anymore.
Right.
Yep.
But then raised in Bainbridge Island?
No, raised in Shoreline, and my parents and grandparents had property in Brennan for years, but everyone in my family now lives in Kitsap. At one point it was myself, my kids, my wife, my parents and grandparents all living in Kitsap.
So it was because of you that you located here?
Yeah.
And I know you love this county as well as I do. And the health of the people that live here is very important. Tell me a little bit about your education, because I know as a doctor you have great credentials.
So I did my undergraduate at the University of Washington. Mm-hmm. I was an in-state resident. I'm one of the few born in the state and still here, I guess. Mm-hmm. And then I did my medical school at the University of Washington and moved away. I actually thought, you know, if I don't move away and get training someplace else now, I never will. And I moved to Chapel Hill, North Carolina, that's UNC, and did my residency. And after that, did a fellowship in infectious diseases at Baylor. And after that, I went to public health school at Harvard in Boston.
Was your career goal to be in public health?
Yeah, it always was. I look back at a mission statement I had said as entrance to my fellowship program, and I said, someday I want to be the director of the health department, and I want to be an infectious disease doc. And I look back at that now and say, well, yeah, I did exactly what I wanted to do.
Oh, what a great goal. Our public health, we've only had 3 leaders, and you're the 3rd one. So we started in the 40s. Mm-hmm. Give us a little history of that.
So the health district was really 2 districts. Bremerton had a district and the county had a district health officer, and they were usually staffed from Atlanta, Georgia. And in 1942, they decided to combine both the Bremerton and the Kitsap County into one district. They hired a gentleman who was the health officer from 1942 till about the mid-70s. Mm-hmm. And then after that, it was Willa Fisher was the health officer until my replacement in 2001. And so I'm actually the 3rd health officer in the history of the county. And
I think you've got such a widespread skill level. And not just Kitsap, but you also are involved with 2 other counties.
Yeah, in our region, we find it good to partner with Clallam and Jefferson. Mm-hmm. And so Tom Locke is the health officer in Clallam and Jefferson. Mm-hmm. He's the deputy health officer here in Kitsap, and I'm the deputy health officer in Clallam and Jefferson. So it creates for a good regional cooperation. And
it's a backup. If for any reason you were out, then there is a backup. And we also, in those 3 counties, we have a workforce development. So it's kind of a neat relationship that we've developed.
Yeah, I think, you know, historically, back certainly right at the time Willa Fisher was coming in as a health officer, the 3 counties were one giant health district. Mm-hmm. So it's a logical pairing for all of us.
Mm-hmm. Now, how do you work, or how does our Kitsap Public Health District work with the state in Mary Selecki?
Okay, so there is a state health department, mm-hmm. but in state law, each county has the legal authority mm-hmm. and requirement to have a health officer and a board of health. So the Board of Health, as you know, is composed of the mayor of every city and the 3 county commissioners. Mm-hmm. And then they are required to hire both an administrator and a health officer, which we have done since 1942. And then we work closely then with the State Department of Health, but the actual authority for public health in the county comes through the Board of Health and Kitsap Public Health District. One big change in the state is Mary Selecki, after many years, has retired.
Oh my.
Yes, and one of our colleagues, John Weisman, has been appointed by the governor to be the Secretary of Health now. So we're looking for some new changes, and it's an exciting future for John Weisman as the Secretary of Health now.
That's great. I do know that not only with the state and with the county where you sit, but because of the new insurance program that's coming, I was pretty excited to read that you and your staff are responsible for the insurance exchange that's going to be made available. Tell us a little bit about what the citizen can expect or how they can come to your office and register.
Right, so with the insurance reform that we're going through in Washington State, starting in January 1, a lot of people will be eligible for insurance. So there's a health insurance exchange that is being set up by the state where people can, depending on what their requirements are, your age, are you employed, what are your health needs, do you have dependents, you'll see what insurance you qualify for, and then we'll help you sign up to get that insurance. So we're going to use not just one single approach to getting everyone signed up for insurance. So whether you are wealthy or don't have a lot of money, it doesn't matter. We're going to help you find a way to get insurance and usually get you through this portal through the computer system. So working with libraries, working with Harrison Hospital, working with KCR, with other agencies like Peninsula Community Health, when you come in, we're going to have avenues to get you signed up for insurance right then and there.
I think having this one-stop area is only going to be beneficial to the citizens. A little background there is that when the federal law was passed, and we call it Obamacare casually, there are federal regulations, and there are 14 states that have actually put together an exchange program where people can learn about what's available to them. And I understand there's about 10 different companies or 10 different sources that are being used now or being developed through this exchange in the state of Washington.
Yeah.
So that's what you'll help people navigate.
We'll help people. We are actually called the in-person assister to help people get signed up for insurance and choose from the benefits exchange what insurance fits you the best.
That's great for us. Let's switch track. And currently, there seems to be a problem throughout our community and the county, the state, about drug use, addiction, and debris. So we'll get right to the point. We have some syringe needles that are on an exchange program, and if you could tell our audience, how does that needle exchange work and when did it first start?
Yeah. So what you're alluding to is that there's been a massive increase in the use of injectable drugs. You know, we always go through trends of drug use. In the 80s, it was cocaine. It goes through different things. Methamphetamine was big when I first started.
When I was a county commissioner.
Yeah, and we did a lot of cleaning up of meth houses and all the debris that comes with meth houses, and that has really trimmed down quite a bit. There's still meth use and there's still cocaine use, but what we've seen is this trend in the use of opiates, and those come in the form of pills. And most people that are using the pills illegally, where they're using them to get high, are either chewing them, swallowing them, smoking them, and the formulations of these have changed, so they're not so easy to smoke anymore, and people are moving to other alternatives, cheaper alternatives, like heroin. So what I'm saying is the drug preference is shifting from pills to injectable, cheaper versions like heroin. And why that's concerning to me is that heroin, while it can be eaten or smoked, most of the time when you're getting to the point of pretty consistent and heavy use, people are injecting it. When you're injecting, you're using a needle. And I don't know how many people know how to inject drugs, but what you do is you put the needle into your vein and you pull back to see if you're in the vein, and you get a little bit of blood in the syringe, and then you use it. Well, if that person shares that with the next, you can transmit infections through your blood. Things like hepatitis C, HIV, hepatitis B, or even just plain old infections at the site where you're injecting, abscesses. So that's a concern for us. So in 2002, the county commissioners set up a program, a tipping fee at the dump, where that money is used to do several things. One, it is used to have clean needles to get dirty needles off the street. So when a person brings in a needle to the health district, a used one, we give them a needle. It gets a little bit tricky, and that's technically called a one-for-one exchange. But when people are using syringes and piling a pile of 20 syringes, that's where it gets unsafe, or if it spills into the environment. So one thing that the program does pay for is these safety containers, or they're red boxes if you've ever seen them on the ferries or anything.
I have.
And we use those for people to put their dirty needles in. Whether you're a diabetic or whether you're a drug user, your needles really should be in these safety containers, which are called sharps containers. And then those are brought in exchange. Now, it is a practice in healthcare that you do not stick your hands in one of those. You do not recap needles. You do not count needles. So there's a very strict formula that many of us in the needle exchange world use for how many needles actually can fit in that box. And then we give, for example, in a small container, you bring that in, we'd give you 50 clean needles. So we keep pretty close track of the numbers that come in and the numbers that go out, and they're fairly astounding how many needles we've increased to in excess of 600,000 needles, and tons of disposed needles that we take to Stericycle and have disposed. So our number of needles have gone up because, let's be honest, the use of drugs has gone
increased.
up. And that's probably the biggest problem we face, is the excessive use of drugs and the shift to injectable drug use. While the needle exchange program will get tons of dirty needles off the street, I think the concern we have is, are we seeing more needles on the street with excessive drug use that we're seeing now? And I know 2 years ago, you really brought this to my attention. Underneath, on Kitsap Way, underneath the pass, the overpass, you asked for us to go, and there were some dirty needles, and there were other human waste issues, and not the most glamorous part of being the mayor, I know. But, and we responded to that. And since then, we clean up many of the homeless shelter camps, and we're not seeing needles there, but we do have a concerned citizen that is finding needles. So the real question we have today is, how much of a problem is this? Okay, it hasn't been a lot of reporting about these, but enough to make us concerned. How much of a problem is it?
I do remember that major cleanup, and I think your staff was dressed almost in hazmat. You were trying to protect them from whatever they were going to come across. It's stayed clean since you went through that process. Also, that concerned citizen, Mr. Robert Parker, has been a business owner, operator down in Callow, and we went through a change in Callow. We wanted them to get some flowers on their street, paint some of their curbs, change the parking, take some pride in that neighborhood. And he was the first in that neighborhood to bring some needles that were found in the alley. We had a meeting with the health district, but you also went and talked to those businesses, and we felt if there was a way of having a sharps container installed and people were aware of it, they would just drop the needles in that and make it a safer place. So 2 or 3 of those businesses, I know that your staff installed those sharps containers. Now, whether they're being used or not, we don't know that. But there is a procedure, and during a meeting Mr. Parker attended, we talked about the program of how the steps to take for someone that comes across a syringe in an alleyway, in a forested area in an out-of-the-way place. And so what are those steps that we would like people to follow?
Right, and these are the same steps, by the way, if you're a diabetic and you have needles. The county has 8 spots that will dispose of needles, and the health district is one of those. The only caveat that we say at the health district is we are not going to take loose, sharp needles. You need to have them in sharps containers so that the safety of our staff is protected. But there's a listing, and we'll put it on the air for people to see, of the 8 spots where you can drop off needles throughout the county, and the containers that are appropriate. So, for example, I have the brochure here. There's essentially a list that says, yes, these are appropriate containers to put it in, and these are not. So like coffee cans or water bottles or milk jugs, those are not appropriate containers to put in, but the sharps containers are. And then on the back of this is the 8 sites that you can drop off. And they really are like the Silverdale Recycling Facility, the Olalla Recycling, Hansville Recycling, Bainbridge Island, Olympic Transfer Station, and the Household Hazardous Waste Facility, and the Health District here in Bremerton. And I guess the point is, when these needles are out in the community, you don't know whether the person has an infectious disease or not. So getting poked by one of those needles, while it's not the highest risk, it still carries a risk with it. So we don't want people exposed to these needles. And so one thing, as we're hearing more from Mr. Parker, we're hearing more from you. I know you're working with the parks folks. All your full-time and seasonal staff are trained to pick up needles in the park.
And our public works.
And your public works. The police departments and the sheriff come across this in the county. This is not unique to Bremerton. We're trying to get a good handle on that. And I think that we're moving today through this show to actually tell citizens in Kitsap County that if you find a needle in the community, we have a number we would like you to call, and that will be listed on the phone list here, but it's 360-337-5235, and ask for the solid and hazardous waste person on call. That call will generate a response to collect information: what needle, where it was found, what time. And I've had our epidemiologists now set up a database so we can collect, say, if your parks folks find needles, what parks are they occurring in, what days, and what type of needles are they, whether the police or sheriff have needles, or if citizens call in and have needles. Then we can talk about how to properly dispose on a case by case, and then keep numbers. And then if there's a problem, what if there's a certain park that keeps being the area of needle dumping, which, you know, I wouldn't think that every park's going to be clean as we're having this massive increase in drug use. So our response to that will depend on the data. So the first thing is to really get a good handle on the data.
So the major thing is, we really want, if you ever see something, or if any of your family members or associates in work have said, boy, I noticed, that phone call is the major source that's going to give you the data for us to have a better idea of the usage and that increase of usage. Our main thing, and I know your main thing, Dr. Lindquist, is prevention. We would like to take and have people get off of this drug. There are ways of doing that. We have drug court, we have, we're looking at a veterans court, we have family court, we have mental health services, and we have our public health for information to go in and visit, any questions that they have, and to help save a life. I know that in the last 6 weeks we've lost 4 people to an infectious disease, and 2 that were less than 30 to HIV/AIDS. Again, it could be attributed to the usage of a syringe or that needle. We really want this program, hopefully, to make a difference in how you report seeing one, and that you can take care of it and then have that data recorded. I wish you the very best for the things that you're going ahead with. I know the state is as concerned, and on a national level, we're all looking at reduction of drug use and keeping our citizens safe. I can't thank you enough for being my guest today. I've learned a lot, and I hope that you have too. I look forward to seeing you next time on Growing Bremerton Together with Mayor Patty Lind.